Running the gardening lifestyle.
Yep. There's the doctor.
Oh, there she is.
Hi. Are
you already home?
Yeah, I've been working from home.
Oh.
How are you?
You're green.
Alrighty. So I'll just go ahead and start saying hi as we wait for the next kind of few folks to sign on. And then Claire can put Dr. Blair kind of up in front. And so thanks for joining us. This is kind of our second educational event that we've had, and we did some polling and lots of people said Friday at 4 works for them. So we will go ahead and kind of keep going on this. And then in May, we're going to do a series again, if it works with the docs, with Amanda and Dr. Cruz-Jarvis and physical therapy. Instead of having our live May event, that'll be like our virtual May event over 3 days. So at that point in time, you'll see some industry logos pop up so we can still try to make money in the middle of all of this. But I am super excited that Dr. Blair is able to join us. And if we feel, and if the community feels they need to have a doctor meeting in between when we start doing them again in May, and now just let us know, because we were talking today as staff from, some of you were on the call last week with Dr. Cruz-Jarvis, and things were already changing. So if you guys feel that, just jet us a message and we can reach out to see if somebody's available to jump on a Zoom. But this is really great for you guys to get that opportunity firsthand. And definitely last week, there was a lot of questions on how to care for your pediatric patient, your children. So I'm excited that Amanda can kind of answer some of those questions for you, and you guys can get some FaceTime with her, because I know it must feel pretty distant, that it's harder to, in a sense, it must feel harder to access them, whether or not it really is. Everything just feels a little further away these days. So Claire, if you want to put Amanda up, I'm not quite sure what her strategy is, but she can be the star here for a second, and then of course answer, and we'll do questions again like we did last time.
Do we want to do our raffle for the Keurig?
Oh, are you gonna do it at the end?
We can do it at the end, yeah.
Okay.
We still have people trickling in.
Okay.
Amanda, are you gonna share your screen?
Or are you just gonna stop?
For video.
Okay. Then everyone can just click on Dr. Blair, and she should pop up as the only screen.
Pin my video. Is that working?
Were you gonna share your screen? Or are we just seeing you?
You're just seeing me. I don't have any slides.
Oh, perfect.
Okay, great.
I think it's still on speaker view. So if anybody talks, it clicks onto their screen.
You can click up at the top and do gallery view or speaker view. And if everyone mutes and Dr. Blair is talking, then Dr. Blair will be the only person on your screen.
Dr. Blair, the hematologist up in Seattle.
So I hope you guys are all having a good day. I'm glad that you took the time to join us this afternoon. Just to briefly update you, I know that Stephanie and her team have got some communication from us about what's happening in terms of the COVID and our response at the hospital. So Children's has made some changes in terms of how we can schedule any of our outpatient clinic visits right now, and actually through the end of June. So unfortunately, all of our comprehensive visits, that includes the whole multidisciplinary team, are considered kind of low urgency. So we're not going to be able to schedule any of our comprehensive visits in person until probably July. So we had to cancel our April. So we had a couple of, several families who were impacted by that change. And we are in the process. All of the physicians now at Children's in our division are licensed to do virtual visits, so similar to this with a video, but the multidisciplinary team is still in process, so they're still working on having that capability for the physical therapists, our social worker, our bleeding disorder nurse to be able to participate in a multidisciplinary clinic. So our hope is that with our May comp visits that we'll be able to start doing a virtual comprehensive visit so that we aren't going to end up with a big backlog of patients who need their comp visits over the summer or into the fall. So that's a good thing. In the interim, if something comes up, if you have a question or a bleed, or we're always able to do just a phone visit with one of the docs or with Maya. Maya does have some days that she's in the clinic actually seeing patients in person. So we still have that capacity, and our infusion clinic is up and running. So if somebody needs troubleshooting their port or an IV placed or a dose of medicine, we can still accomplish that really easily just with a phone call. Otherwise, I think in terms of the impact of the infection or the COVID-19 on the pediatric population, Children's has started doing a large number of testing and have actually tested, I think it was like 1,400 patients the last time we had an update, and only 14 pediatric patients were positive for the virus. So I think that overall the incidence of the virus affecting the pediatric population is very low. And most of those patients are not hospitalized. So I think overall, the biggest impact for us is from a manpower standpoint and the kind of need to keep providers and nurses able to kind of be deployed in whatever area they might be needed in other parts of the hospital, the ER or the ICU, because our ICU has been flexed to allow older patients to be admitted, so up to almost 30. So I think just trying to be prepared, but overall, the hospital seems eerily quiet when I have been there in the last couple of weeks. Does anybody have any questions or specific topics you want to address?
Hi, Dr. Blair.
Hi.
So I've been curious if for some reason we need to come in for a fever check. What is do we need to be overly concerned? Yeah, the 27th time you've gotten that today.
No. So I think that's a really good point. We still have quite a few patients who have ports, and so with the concern about fever, it's still really important to make sure that you're following the normal port care. So it's important to make sure that you're still flushing the port as often as you're supposed to. Some of our patients on Hemlibra aren't using their port regularly, but it's still important to make sure it's getting flushed at least once a month, or at most maybe 6 weeks if you want to push it. But I think the families that we've had who did have to come into the ER for urgent injuries or fevers recently, it's really the same protocol that you call to let the on-call providers know that what you're coming to the ER for. We're able to alert the emergency room ahead of time so that they can hopefully be prepared and kind of enact the plan that needs to happen right away. Like I said, I don't think our ER triage system, I don't get a sense that the volume of patients coming to the ER is excessive or worse than it normally would be. Children's has started basically having providers and nurses do standard or kind of strict isolation measures for all patients. So whether you have symptoms or not, definitely if you have fever, you probably would get swabbed for COVID. So everybody's wearing masks and goggles, and so, but that's kind of the standard now for every patient, whether they're in the ER or you come to clinic too.
Should we, just planning if this is for the next couple of months, like we've got Zach around compromised family members.
Mm-hmm.
If he does come to the ER, should we just plan on doing like a 2-week quarantine when he gets home before he comes back into contact with anybody else?
I think that's a reasonable approach if you can do it. I know for some families, they share the same house, so it's not always possible to stay completely away from those people who might be at higher risk.
Okay.
So I think if you have the option to isolate for a couple of weeks, that's a good thing. And I think particularly because there is evidence that children don't tend to have the same symptoms or may not have symptoms at all and be asymptomatic shedders, that it's an ideal approach to take.
Okay. Thank you.
Yeah.
Who else has questions?
What about supplies? Should we keep a higher amount of supplies during this time just in case, because everything seems to be running low everywhere else?
That's a really good question. We actually have been participating in regional conference calls every week, actually started at 3 times a week to talk about this issue at other treatment centers in the region. And fortunately, nobody has really encountered any issues with supply chain or factor supplies. So, we generally recommend that you not run, once you get to have about 2 weeks of medication supply left, that's a good time to refill, just because you never know when your insurance is going to require a prior auth, and that takes time. Some insurance plans are allowing you to get a refill earlier, or to maybe get an extra refill than you normally would be allowed, just so that you have a little bit of extra supply. But the general sense and recommendation is to not hoard or stock up on medication, because all the manufacturers have really felt like they have made processes or put processes in place to make sure we don't have issues with not having access to factor.
I've got a question that might just be very specific, so I hate to waste everyone else's time, but I'm curious. So Will, he's got a port, but he's on Hemlibra, so we just flush it once a month, and that seems to be working.
Mm-hmm.
I'm testing his temperature all the time because his brother has had a fever of 101 or higher, 101 or higher for 27 out of the past 28 days.
Oh.
And I had him tested. He's fine for flu and for COVID and for pneumonia, but he was knocked out and actually went to the ER a couple weeks ago with all the symptoms of COVID, except the chest X-ray was beautiful and his O2 was beautiful, and I got tested. I'm fine. So I don't know what's going on. He's much better, and so I'm not concerned about Jack. He's not sleeping 16 hours a day. Doesn't have the harsh cough. He can breathe. He doesn't pant going up a flight of stairs or anything.
Yeah.
But in regards to, just to be double sure with Will, I check his temperature twice a day too. He's never been above 100.1. And I just think, oh, so what? And there's no extra concerns, correct? I don't need to worry about anything else unless it gets above 101.5, just kind of normal protocol.
Correct. So,
Okay.
Even the guidelines from the health department and from the state have been that if you are otherwise healthy, meaning you're not on medications that suppress your immune system, or you don't have really severe asthma or breathing issues, that if you can get tested for COVID, depending on the likelihood or your symptoms, then that's helpful in terms of informing your contacts. But otherwise, really, home care is all that's really needed. So just a lot of supportive care, unless there's issues with breathing or respiratory distress.
Awesome. Great.
Yeah.
Thank you.
Mm-hmm.
Okay, who else has questions? I know you guys do.
I have another question. So can you walk us through, I didn't get to hear all of Dr. Cruz-Jara's last week, but if like one of our kids was to get COVID and are there any other things that we need to know about? Because I heard there's something with microbleeds in the lungs that could happen. So treatment wise, is there a plan in place for like if a hemophiliac got it?
Yeah, I think the best information out there has been some of the adult hematologists who have published their experience in adult patients who were infected or in the hospital with COVID. It's really interesting that it affects some people very differently than other people. The people who have been really sick in the hospital have had issues both with bleeding, but also with developing blood clots. So there's actually some guidelines around putting patients admitted with COVID on blood thinners to prevent them from having clots while they're in the hospital. I think that the concern about bleeding in the lungs has not been something that I've seen reported in any of the pediatric population. But I think if you had any concerns about breathing difficulty, certainly if anybody who had blood in their lungs would have breathing issues and be struggling, would definitely prompt coming to the emergency room for evaluation. And I think given the diagnosis of hemophilia in mind, we always think about whether or not it could be bleeding. And most of the time, giving some extra factor is not going to be harmful. So I think we're still definitely learning a lot about this infection and how it's affecting people of all ages differently.
Dr. Blair, do you guys have any forecasts that we haven't heard on King 5 or any that you want to share?
I wish. I think that it's been really nice to see the information coming from UW, and it's nice to know that the full scientists are helping now in terms of predicting the infection. And the numbers I've seen from the adult hospitals recently have kind of been more flat. So I don't know if I know the suggestion was that we were going to hit our peak in the next couple of weeks, but it seems like we may have maybe hit it already or just are at the plateau right now, and hope to start seeing numbers come down. I've been really pleased just compared to nationally how we seem to start having diagnoses around the same time as other countries or other cities on the East Coast. And it seems like the early measures that the state took here, or the governor took here, although at the time seemed overzealous, have really helped a lot in terms of limiting and preserving our health system capacity. Yeah, so it's hard to imagine what the future is going to look like.
Yeah. I have another general question, if that's all right.
Sure.
Keeping the kids active is always a priority, and sometimes a struggle. And I've got them mowing the lawn, they're doing chores, we're playing catch in the street, but what can we do? Anyone, just open to the group. I'm curious to see what people are doing. I mean, I just make them run up the stairs every once in a while just to.
Benadryl.
What's that?
Benadryl.
Benadryl.
They're all over social media right now, especially like Instagram and stuff like that. A lot of the CrossFit affiliates and that sort of thing are doing a lot of online programming that you can do at home with just body weight stuff. So like a lot of calisthenics and stuff, they're having online competitions and stuff you can enter and get onto the leaderboard and sort of compare yourself to other folks. So there's
really?
Yeah, there's tons of stuff out there.
I'm not connected to any social media, so I'm just whatever.
We have some like exercise bingo.
What is it called? Exercise bingo?
You do like exercise bingo. I think you could probably Google it, and you just print out a little form and roll a dice or like spell your middle name, and there's different exercises for each letter. So I think there's a lot of There's a lot of options in terms of just a
There's
home.
one called like a Deck of Death, where you use like a playing card, and each suit of the playing card is a different exercise, where it's like a push up or a sit up or a squat or something like that. And every card you pull off the deck, that's the number of reps, and that's the exercise that you have to do. So like I said, there's just tons of stuff out there. Just Google it. Just, you know,
Cool.
at home workouts. And like I said, it's body weight stuff. It's stuff that you're going to have laying around the house, water jugs, you know, that kind of stuff.
And
I guess bike riding also works. We've been bike riding like maniacs. Obviously, it only works if you live in a community where bike riding is feasible. You know, where you don't run into 20 million other people.
and you have a helmet.
Obviously, that goes
Awesome.
without saying.
Just order a trampoline on Amazon, right?
Oh,
Yeah.
Oh yeah, absolutely. We're
Yeah.
getting right on that.
Would
No,
you?
but Cosmic Kids has a free trial if anybody's into yoga and like Frozen, and they do yoga to the Frozen story, and it's
The
wonderful.
Cosmic Kids Yoga is actually also free on Amazon Prime.
Oh, cool.
There you go.
I saw that the American Heart Association was doing something like the Hoops for Heart and Jump Rope for Heart that they've done in schools. They're doing something online so that kids are staying active.
Hey guys, that's fantastic answer. I've got a lot of notes. Thank you all.
how's the homeschooling going?
It's going.
It's going.
It was a trick question, right?
Yeah.
It seems there's a lot more downtime than I imagined there would be.
We're totally using the 27 workbooks that I ordered on Amazon the first 2 days.
It is kind of
Yeah.
impressive
Oh, yeah.
too, because
Mhm.
you know, from
But
not
Khan Academy
knowing.
actually has a lot of great free stuff too. So that's a good, if you haven't heard of the Khan Academy.
Yeah.
Yeah.
Is this the right venue to bring up a question about summer camp? Is that gonna
No,
happen?
it's not, Dwayne.
Sorry. I'll go back on mute.
No, still more to be revealed. I mean, if I had to guess the writing on the wall, and anyone can kind of guess that. But yeah, we'll meet in a couple of weeks with the docs and figure it out.
Hannah's camps have just been being canceled left and right.
Are
She's
they?
disappointed? Well, because like Girl Scouts as in Western Washington decided to cancel all events through September.
Yeah.
So no, troop camping, no service unit camping, no volunteer-led camps, no overnight camps. So that got canceled entirely. And then one of the church camps that she goes to was like, oh yeah, we're still doing church camp. And I sent an email back like, wait, whoa, really? Are we sure about this? And then like 2 days later, they had canceled everything. They're like, no, wait, we really aren't. Never mind. But she has space camp in Alabama and they aren't even shelter in place. And so I'm like, I know that you guys haven't canceled space camp, but I don't really think that anybody should go to Alabama right now. Like, that just sounds like a bad idea. So I think we're going to pull the plug on Alabama.
You would also think they wouldn't want you there, right? I mean, aren't we a hot zone? Like, we're all infected, obviously.
Oh, no, I called them and they were like, oh, no, we're not canceling. It's not an issue here.
Okay, this is how this stuff spreads.
Right,
Right? Clearly, they haven't gotten that yet.
Yeah, it really is an issue there. And we're from Washington. And she's like, oh, how you guys doing? All right, lady, your Southern accent is not making me feel better about this.
Well, I have a question for you guys. I know we have a wide variety of ages on here, but there's lots of dynamics when it comes to camp. And I think for me, I mean, I haven't talked to Dr. Blair, Dr. Cruz-Jarvis about this in a few days. We talk pretty regularly. But for me, the fact that UW canceled its first, or is doing online for its first quarter, they were the kind of that first big where you could have people spending. But if we had camp, would you feel comfortable sending your kids? If you just want to do, like, we can do like maybe just do like thumbs up.
When is camp? Like
Mid-July.
regular camp?
I'm just kind of doing this as like a feeler, right? Because
I mean,
No,
I feel like my thumb is up because you would only have camp if you feel like you can be safe.
Yeah.
So I just want to tell you guys, a number of years ago in Oregon, we got a simple case of norovirus. And we sent home 16 campers, and I can't remember the number, like 8 or 9 staff members. And that was just a simple norovirus. And it's that communal living situation where there's just not a ton of hand washing or, people being safe and sanitary and that kind of thing. It just kind of makes me nervous. That's just, my own compromised immune system. So I just thought I'd bring it up here in front of you guys and ask.
I think it depends on what's going to happen in the next few months. I mean, right now, July seems really far away, but in reality, I mean, I'm still struggling to get through the school year because now no more school for the rest of the year. But at that point, I think it just depends on how things go. If by the 1st of June, there's still severe lockdowns, still outbreaks, I think then I would call it and say, no, she's not coming. But anything can happen. We might actually have hit our peak, and this might all eventually trickle away, and we might start opening up by end of June, and then there's still hope. But I think it just depends on how the virus goes, and until people actually really truly do shelter in place and stop going out and doing the recommendations, it's really just going to be how things work out in the end. So it's a hit or miss right now. If it's going in the right direction now, then I would say it's fine. But if we have another breakout, or people are being dumb and decide to come out early because, oh, it's over, then it might not be such a good idea.
For me, the virus isn't going to go away. It's still going to be around 3 to 5 years from now. It's just, is it going viral or not? I think for me, and I've got a situation where the kid's mom and I have split, so it's a joint decision. So I'm not going to give you my opinion one way or another. But what would weigh heavily for me is if the 15-minute rapid testing were much more available at that point, because then you could immediately find out, and you can do it there on site, and you've got all the caring professionals and caring patients, and it seems a lot more reasonable in that case. But you're right. We've got to get through the next month, and then but hopefully there'll be some technological advances along the way too.
Okay, I just thought it's important to get your guys' kind of thoughts on that. And I will tell you is that we will make the call no later than 2 months beforehand, because that's when we would have to make our next payment. So this, my job is to make sure that I'm being responsible with the money that you have helped fundraise and the institution. And so I will always be transparent and honest with you. And if Camp Houston calls it beforehand, obviously I'll let you guys know. And obviously if the medical providers call it beforehand too. Some of the things, depending on the different state, a lot of hemophilia summer camps have been canceled because their medical providers are attached more to hospitals than some of ours are. And so they are being pooled to other like departments and stuff to help. And that's one of the things we'll have to look at is like, will we actually have medical supplies? So I don't know about you, but I can't find hand sanitizer. So it's stuff like that. So there's lots of different layers, but it will be no later than 2 months beforehand, because we wouldn't want to have to make that next payment and then cancel the last minute. So yeah. Dr. Blair, do you have any thoughts on any of that?
No, I think, the theme is that it's really too early to know what to expect 3 months from now. But like you said, I've heard from colleagues who have coworkers in New York and on the East Coast or Chicago, where the pediatric providers are being pulled into the ER or the ICU or other places. So I think we don't have any limitations at this point on being able to be away from work, but it certainly could change depending on how things flux with medical capacity.
So how are your kids doing? Are they holding up okay? Is there more things that the BDFW can do, or not that I put things on Amanda, but I guess I am. But are you getting the support that you need, or if there's things that we can do? We'd love to hear from you guys. I'm hearing from Mr. Forrester. We have been looking at doing different things online for working out. So that might occupy his sons if they're willing to jump on. But love to hear what you guys are thinking and how you're feeling. Miss Fujimoto, I can see you.
They're doing great, but they're active anyways. So
yes,
I just outside in the backyard and they entertain themselves. I just have to make sure Daniel doesn't hurt himself. That's the biggest thing, because we don't want to have to go to the ER if we don't need to.
Mm-hmm.
So that's our biggest concern, is we just don't want to be in the hospital.
My kid's doing all right. It's a new norm. Just a new normal, setting up the homeschool and everything, doing tech support. Oh, yeah.
Well,
That's the hard part for me.
Fallen off a wall and gotten a huge bruise all the way down to her thigh, but I'm like, she's gonna be fine, because she's gonna be fine. If it does come to that and we do need, because I don't infuse at home, is it safe to go to Children's, or am I going to call and do the clinic? I mean, how is that going to work for me? I mean, since she's mild and she only infuses when she gets severely injured, it's typically a hospital stay for infusion anyway.
Yeah, so I think the benefit of our clinic is that we have our infusion clinic is open 7 days a week. And so we always have nurses there available to do IV infusions. It's certainly not ideal to have to go every day for an infusion, but for some families, we're able to spend time teaching how to take care of an IV at home. And so then it's just a one-time trip in to have the IV infusion.
We've done IV before the last time. So it would just be getting it in, just like typically last time it was hospital stay, which was horrific, but hoping if it's not that, but if it was something that I could, I know she needs factor because it's severe enough, but not severe enough for a hospital stay, I can go into clinic and just get an IV put in and deal with it that way. Okay. I've just never had to. So I'm like,
yeah, so you would just call, so during the day, you would still just call our hematology clinic, the 987-2106 number. Okay. Usually for an acute concern where you think you need to come in for an infusion, you should ask to talk to the triage nurse. So we have a nurse who takes the immediate concern. We'll then find either the provider of the day or one of the hematology nurses to kind of talk about management. And then they'll either call you back and schedule the infusion visit, or sometimes it's just a matter of coordinating when we have an infusion slot and when you can get there, and just making sure we have all the orders in place for that. But we're typically, for the most part, able to accommodate the same day. If it's 5 o'clock, then it probably is going to be a trip to the ER, but we try to avoid that as much as possible.
For what it is worth, I work at an area hospital in administration, and so I'm very aware of the situation in general and a lot of the greater concerns. And having recently taken my eldest to the ER at Children's, I was very curious to see how they're holding up to the standards and what the procedure and how everything was going on. I was hyper aware, passed it with flying colors. I thought that they absolutely crushed their mission to keep themselves and everyone else safe along the way. It was really impressive. I was and that was 2 weeks ago, so it's only improved over that time. They're doing a great job.
Yeah, that's great. So I know they've really been thoughtful about limiting entrances to the hospital. So there's 1 staff entrance and 2 patient entrances now. So every person who goes into the hospital is screened with asking about symptoms and a temperature check. And then I think most patients, I think, are being off face mask, whether you have symptoms or not, just to wear until you're in your room for your exam or for your clinic visit. So although we do, want everybody to try to avoid the hospital, I think sometimes accidents happen, especially when you have idle children. So I think just feeling like you can always call us to talk about what's going on and your concerns, and we can help triage and manage from there. Yeah.
Alrighty. Anybody have any other questions? Thoughts or comments, hopes and dreams, things we can do for you?
I think Hannah and I both need more human contact. So I'm up for as many things that you put out on Zoom as possible, whether that be for parents or kids or whatever. I mean, Claire doing yoga or Erica, I don't know, making balloon animals. I don't care. Like,
Erica hurt herself doing online, working at home, working out on home. So that's why she's off.
And have a coffee date for the adults, or adult beverage, whatever your choice is.
Yes, like,
I agree. I haven't talked to another human besides my husband in a long time. I feel like I'm going crazy.
I mean,
so would you guys like a coffee date / whatever you want to drink? No judgment, and no judgment drinking hour?
Yeah.
I love how we're all very PC.
My coworkers have put together socials at say 7 o'clock on our Thursday night, where they will drink their beverage of choice and just talk for half an hour, and then they just disconnect and go on, and they love them. I've not done it, but
yeah, everyone has like their different levels. So what time of day is this group specifically? And then we can kind of ask like what kind of, in the evenings, afternoons, children are down.
Before dinner.
Before dinner? When do you
For me,
eat?
at least.
Yeah.
This is good. 4 o'clock's a good time.
It was funny when we surveyed, Thursday or Friday. I was surprised how many people said Friday. So yeah, okay, so 4 o'clock.
4 o'clock works.
Okay. Do you like the idea of having it like always Friday at 4, so it would be something you could kind of like pencil in?
Yes.
Yeah, not a bad idea.
Okay. And then we could kind of vary it up, whether it's like, hey, you want to read a book, or you just want to chat, or it's just a check-in, and it doesn't have to necessarily be bleeding disorder related. I mean, I know you want to talk about that all the time. But then sliding them in too for like when we have an education component or whatever. So we can easily do Zooming. So, but yes, and also too, if there's some of you that want to get together and you want to use the BDFW Zoom or whatever, just let us know. We can help arrange that. So, and we are working with Mark from the Blood Center to do some stuff. So, would you guys want to take like a yoga class on Zoom together?
You don't want to see my downward dog.
No, I didn't like, I just want to put it out there.
I was about to say, if I don't have to turn my camera on, I'm all for that, but nobody needs to see this either.
Exactly.
I know, right? I'm like, just bring a whole new level. Do you want things for your children or more for you?
I don't know if anybody else. Sorry.
Go ahead.
I don't know if anybody else is experiencing that. I'm having a hard time getting Zach, who's 5, to participate in any online stuff over 30 seconds. So I've scrapped it because it's just a big waste of time. I'm more looking for survival tips and tricks because he won't do anything online.
Can we duct tape them to the floor? Is that survival? We duct tape them to the floor?
As long as you use a marble as a maze, call it STEM, you're good.
Nice.
I know that Hannah really wants play dates, but I can't like get families coordinated for that.
Oh, yeah.
So maybe if we had like a camp thing. I mean, she loved campfire the other day.
So I had a thought about that. I was in a brainstorming session yesterday and I started thinking, what if we did an online variety show? It was just a thought.
Well, that has been one of the things that she's really bummed out about, that if camp gets canceled, that she would not get to do the talent show. And that would be really disappointed by that. So anything of that kind of realm, whether, you know, if campfire was great, or, you know, getting the camp age kids, you know, who are willing to sit in front of the computer, you know, they're just going to complain about us and homeschooling. So great, not a problem. But she definitely is missing that face-to-face, and our school district is doing very little of that. So
yeah, I think that age is super tough. Does she play video games?
We don't let her. For all the technology that we have in our house, we don't let her do stuff like that. And I think that is part of it too. She had a friend from Hebrew school say, oh, we can play this game together. And then we looked at the game and we were like, yeah, that's a first-person shooter. No. Like if we were talking about a, I don't know, car racing game, we probably would have made it happen. But
Ms. Fujimoto and I can probably smile in this one. So my middle son is in 4th grade, and so he plays video games, and I can hear all the conversations, but it's the way he is engaging with his friends.
Yeah.
And like, you know, full-fledged conversations that they're having, because he's in 4th grade, and so he's not Zooming, he's not, you know, having a phone conversation, but he's staying in touch with his buddies. So that has definitely been a way for him to be a little bit more socially engaged.
I guess I would have to, I mean, Justin knows enough as he walks away from the conversation, but you know, I would have to figure out what games kids in her class are playing and that sort of thing to see what was worth approving, I guess.
Yeah, it's hard though, right? Like that wasn't my jam, but you know,
really like the FaceTime for speaking Spanish. So,
but don't worry, my toddler will be playing video games probably next week, because of the age difference, we have no level of good parenting. So
no judgment.
My opinion and view that you get from me, the 13-year-old and a 3-year-old.
Yep.
I am supportive of all parenting bribery and methods you can come up with.
Yep. And you can always ban them if they don't listen. So that's a good.
Yes. You have to have some sort of leverage.
Yep.
Until the toddler that's 18 months quotes some sort of.
Oh, go ahead.
No, go ahead.
No, the Switch, if anybody has a Switch or something, like my husband and I, he works for Nintendo, so they did like a 4:00 Sunday, like a bunch of the employees got on and played Mario Kart. Those are games that can be played in bulk with random people, or have a, like, just people we know can sign on and do like a Mario Kart session if you had a Switch though.
Yeah. Oh, somebody asked how my baby's doing. She's good. She's big. She's out the park. Well, they're walking to the school. We had to ban her from the house because she would not leave. So, but yeah.
Hi guys.
And then it was Fallon's birthday, but and then we had Nathan's birthday too. So, and how are all those parents doing with those young babies? You guys surviving?
Hi.
Hi, Heidi.
Sorry, I had a work call.
Good. Well, and how is Cyrus doing? You can see Amy's name.
Hey, he's doing good. Thanks for asking. But we haven't been, I think one thing I should mention is we usually have pretty steady schedule for the prophy doses. Now just kind of, I lost track of days. So, you know, from, So it's just like 1 or twice a week now from the typical 3, maybe sometimes 4th time on the weekend, depends on the week. But besides that, yeah, we're doing well. Yeah.
Good. Do you have a comment, Dr. Blair?
No. Just Profi's important. And
I know. Just
life happens. It's hard.
I know. It's just we got too relaxed now because we don't have that rush. Have that schedule or urgency.
Yeah.
I figure I can do at lunch instead of morning, but becomes the next.
And I'm sure his a lot of his activities are not happening, so probably a lower activity level in general.
Yes, yeah, that too.
Yeah. Lindsay, is it poopy?
I think I have to go.
That was awesome.
Say bye-bye. Bye-bye.
So sweet.
Nathan's been potty trained, so we're loving the no diaper thing.
There you go.
Hannah was like, I don't really care about being potty trained, even like into kindergarten. And Nathan's like, nope, I'm done. Me and the potty are good. So I'm super grateful about that.
Alrighty. Any other questions or ideas?
I'm really glad to hear that the ER seems to be fairly normal. I mean, that's one of those things, just a worry in the back of your mind. Like, what if I have to make that run? Yeah. What is that going to look like? And is there going to be staffing available and all those sorts of things? So that definitely is helpful just to know that.
Yeah, well, I like Children's has really stepped up in terms of their staffing and their planning, and they have like a separate entrance for the patients coming in with concerns for COVID or fevers, with some of the other urgent needs. And so we've had a couple of families recently who had to go to the ER, and it's I think the key is really still, I think, to call ahead and talk to the on-call team so that they can help advocate for the quick evaluation and triage right away.
Okay.
Yeah.
Alrighty. Well, thank you, Dr. Blair, for your time.
Yeah, you're welcome.
You.
Yes. And we're actually going to do on the 24th, Dr. Blair's been working on a project with NHF. So we're going to do something online. It'll probably be through not Zoom because they have their own system. So you can say you have something to do now on the 24th, which, pretty much the highlight of anyone's day when they think feel like they have plans. So did you want to talk about that, Amanda?
Yeah. So it's a session with a company called Prime, who focuses on medical education, but it's partnered with NHF and really focused on just having a good dialogue about how to foster collaborative care at your clinic visits and with your team. So hopefully myself and maybe one of the nurses, maybe our genetic counselor, some of our staff will be able to participate in the program and just have a good discussion about shared decision making and what does that mean and how can you incorporate that so that you feel more like a partner in your child's care or your care going forward.
Okay.